In the healthcare community, we are very aware that there are disparities that cause Black and Latino women from having poorer outcomes in their breast cancer care. So, one of the most important things that I urge you to do is to really become a advocate and also a shared decision maker in your care.
When a woman is newly diagnosed, her tumor is sent to the pathology department, and the pathologist does a series of tests that are done on the tumor that include testing for estrogen receptors, progesterone receptors, and HER2/neu receptors. Those are basically proteins that are present on the cancer cell, and they help us decide what treatment a woman should receive. Genetic testing relates to the study of genes that are altered in your blood and genes that are present throughout your entire body. The reason to look for genetic alterations like that is to look at heredity. So when we're looking at genetic testing, we're thinking of genes that are inherited from generation to generation. We're looking to not just test the patient and understand why they developed cancer, but we're also looking to see what the implications are for their family members. Genomic testing, on the other hand, is testing specifically on the tumor. We are looking for genetic abnormalities that have occurred in that tumor and that tumor alone, and not anywhere else in the patient's body. There are a variety of genomic and genetic tests for breast cancer, and they are used at various points in a woman's course, in a woman's trajectory. The risks and benefits exist for any test. You are going to be getting information about risk. You're going to have information that will tell you not just about why you got cancer, but also that other individuals in your family are at risk.
Patients may wonder whether the results of their genetic or genomic testing may have an impact on their family. We know that for a fact that genetic testing will have an impact because any mutations or changes in genes that a patient may have every child that they have a 50% chance of inheriting that gene. So that will definitely impact, and it will impact not just your children, but there's a chance that siblings, parents may also be impacted by those results, as well as extended family members. It may be difficult to speak with family members about genetic testing, but the truth is that that information can help family members make a decision about whether they need to have extended testing for themselves, whether they are at high risk and need to take further steps to care for the risks of cancer in the future.
We are very fortunate in the United States that we have access to both genetic and genomic testing for large sectors of our population. Most insurance companies cover for the cancer patient access to genetics and oftentimes genomics. We also have the capacity to work with the labs when we have a patient who's uninsured or unable to pay. We sometimes can get those services provided.
It is important as a woman of color for you to advocate for yourself, for you to follow through with your appointments, for you to ensure that you are sharing in the decision making so that you have really, you're part of the team and you feel like you're getting the care that you want to receive in the way you want to receive in a culturally competent, linguistically competent manner. So, one of the best ways to ensure that you are actively participating with your team in making decisions for your care during that newly diagnosed period is ensuring that you have the opportunity to get all of your questions answered. Don't be afraid to speak up. Don't be afraid to discuss your concerns and your questions, and just really reach for those team members, reach for the people that want to support you in your family, in your friends, in your community, because we cannot treat this disease alone.